Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine.
Antimicrobial prescribing guidance a must for dental professionals. Dental infections usually present with symptoms of either pain, fever, or even swelling at times. Surgical or endodontic treatments are the early management of infected teeth, followed by antibiotic therapy. A study published in the International Journal of Dentistry suggests that comprehensive antimicrobial prescribing guidance should be established for dental professionals. A group of researchers summarized the indications of antibiotic therapy in dentistry and also highlighted that there are common class of antibiotics that are routinely used in the dental practice. Hence, it was concluded that accurate use of antibiotics is crucial for the treatment of dental infections. Therefore, accordingly, comprehensive antimicrobial prescribing guidance should be established for dental professionals. COVID-19 infection may lead to small fiber neuropathy on ocular surface. COVID-19 virus has more adverse effects on the human systems than reported. With upcoming variants, the virus is continuing to affect largely with various symptoms and pathologies. New research discovered that the SARS-CoV-2 infection may cause small fiber neuropathy on the ocular surface with symptoms and morphological characteristics similar to dry eye disease and even diabetic neuropathy. The findings of the study were published in the Ocular Surface Journal. In conclusion, this is the first report of corneal neuropathy symptoms in people who have overcome COVID-19. The existence of morphological changes in individuals up to 10 months after recovery from SARS-CoV-2 infection indicates that the neuropathy is persistent. Fourth dose of mRNA-based vaccine may be warranted in some kidney transplant recipients. Kidney is one of the most affected organs in COVID-19 patients. Kidney transplant recipients receiving immunosuppressive drugs have impaired immune responses to the messenger mRNA COVID-19 vaccines. Consequently, despite standard vaccination with mRNA vaccines, many of these patients remain at high risk for severe disease during the ongoing pandemic. The FDA has authorized immunocompromised people to receive a third dose of mRNA vaccine after the standard 2-dose regimen to further boost protection. A case series published in the Annals of Internal Medicine finds that a fourth dose of an mRNA-based vaccine produces a satisfactory antibody response in some kidney transplant recipients who did not respond adequately after 3 previous doses. These findings, however, support the use of a fourth vaccine dose for such patients. Breastfeeding reduces mothers' cardiovascular disease risk. The health benefits of breastfeeding for children are very well known. According to the World Health Organization, it is linked with fewer respiratory infections and lower risk of death from infectious diseases among the children who were breastfed. Breastfeeding also has been linked to maternal health benefits, including even lower risk for type 2 diabetes, ovarian cancer, and breast cancer. According to a meta-analysis published in a pregnancy spotlight issue of the Journal of the American Heart Association, women who breastfed were less likely to develop heart disease or a stroke or even die from cardiovascular disease than women who did not breastfeed. Factors beyond carbs might influence postprandial blood glucose in type 1 diabetes mellitus patients. Carbohydrates are the staple diet of most of the world's population. They are the main determinants of postprandial glucose response as well. However, a study suggests that nutritional factors other than the amount of carbohydrates significantly influence the postprandial blood glucose control. The study findings were published in the Diabetology journal. The researchers showed that nutritional factors other than the amount of carbohydrate significantly influences the postprandial blood glucose control. These nutritional determinants vary between breakfast, lunch, and even dinner, with differing effects on the postprandial glucose profile and insulin requirements, thus remaining a challenge to the hybrid closed-loop system.
That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.